How are you?
Well,
It's so nice to see you and to hear from you.
yeah, well, you too. I'm sorry to bother you on it. I kind of didn't realize it was a work day. So,
I had kind of forgotten that when I was talking to you also, because when I was scheduling it, because I was assuming that some of the regular meetings wouldn't happen, but it's full speed ahead. And we just found out that somebody who has COVID, who's a visitor here, who when we called this person to talk to them about isolation and where they'd been and all that, they said, I'm in California, and hung up. And we wanted to be able to notify the people because they had been staying at a house here. But this person wouldn't call us back. So we sent folks out to the house, and guess who answered the door?
the guy. So
But
people don't want to be traced. They don't want to be.
right. So anyway, fortunately though, the local police department has a deputy chief who sits in on all these meetings. He goes, where are they? I'll arrest them. And I'm like, you will? Because I know usually they need health department orders and stuff, but this person was, because they didn't have a negative test, they were still under quarantine for travel. So they can be arrested for violating that. And we know that they weren't staying home, even though they're telling us they were, because we looked at their Instagram account and it's like all over the place.
Wow, you guys are really working at this.
Yeah. So what can I help you with?
Well, okay. So I've been doing all this training of HR people, and we have developed a course with Columbia on public health for the workplace. HR people in companies are getting thrown into public health related topics about protocols and safety, and
Sure.
now they're going to have to figure out what to do about the vaccine and whether people have to be vaccinated to come back to work, and just endless questions. And as I've been reading up on public health and learning about it, there's so many things that you guys do that people in business don't think about. I just wanted to kind of get your perspectives as a public health professional, and you've done it for a while. How do you guys think about this problem as systemically? Because in companies, it's usually, let's get the workplace safe, period. And then they say, oh, wait a minute, what about the commute to work? Well, what about the travel? Oh, what about the meetings? Oh, what about the equipment? Oh, what about the desks? It's sort of this cascading of discoveries. You guys probably would have started with, wait a minute, you're not thinking about the problem correctly.
I don't know that it's not thinking about it correctly, but it's thinking about it differently.
Yeah.
So I think that one of it's kind of random thoughts, but one of the things that I've noticed about the workplace safety discussion is that, so if you take restaurants, food industry as an example, when public health is thinking about restaurant and food establishment safety, we're thinking about how are we going to make it a safe place for diners to go? Because the businesses want to be open. They want people to go there safely. We don't want disease to spread there. So we're thinking about put the tables far apart, have people wear masks except when they're eating, have good ventilation, have frequent cleaning, have hand sanitizer available for people. And then we usually go the next step and think about, well, the employees' interaction with the public and what's protecting the public, but also what's protecting the employees. And so the employees should be wearing masks, and the employees should have breaks and wash their hands and all that kind of stuff. But the employer tends to come at it from what's the risk to my employees, and maybe start in the back of the house, so to speak, where public health, because we're looking at the whole community, that sometimes comes later in our process, although it's there also. But what we've seen is that we've seen restaurants where there's compliance, if you will, with all of these safety measures that are primarily focused on protecting the diners and the staff from each other, but there's laxity in protecting the staff from each other in their back of the house activities. So everybody's doing fine when they're waiting tables, but then in the kitchen, they're close together and they don't want to wear masks because it's hot, or in the break room, everybody takes their masks off so they can eat, and that is crowded and poorly ventilated. And that's where transmission is happening. So there, the things you need to do are the same in all of those contexts, but it's really the challenge is, as you say, to keep identifying all of the contexts.
Yeah. Well, the other thing that's come up in the last couple of weeks is employees de-escalating non-compliant customers in stores who refuse to wear masks or whatever. Do you guys deal with those kinds of issues, or what is your perspective on that problem?
It's a sticky one. We try to empower the private businesses as much as possible to have in place policies that you can't come in if you're not wearing a mask, and to offer alternatives for people who can't wear a mask or don't want to wear a mask. We'll deliver, we'll provide curbside pickup, that sort of things, where those sorts of things where that's relevant. I mean, you are probably as familiar as I with how that intersects with ADA issues and public spaces and all of that.
What have you learned about how to change people's behavior? See, to me, this is the ultimate issue of collective thinking.
Yeah.
You're safe, you're protecting somebody else, they're protecting you. You can't get the virus from an inanimate object. You can only get it from another human being. So everything has to do with thinking about somebody else, not yourself. How do you think about changing that kind of behavior?
Well, a couple of things. One, that the CDC has come out recently, and there's good evidence that wearing a mask, even a cloth mask like the kind I was wearing, does actually provide significant protection for the person wearing it. So the messaging now is stronger that this protects you and others. Okay. And I think that, that is helpful because people are primarily concerned about
themselves.
Right? It's like, I want to be safe, so put on your mask.
Yeah.
In public health, people talk about social norms change. How do you get people to do something different? And we don't have a quote unquote magic bullet for that. If we knew how to make people behave safely, a whole lot of things would be different in our society. But I think that big picture, I think about about tobacco. So when you and I were kids, people were smoking in restaurants. They were smoking all through airplanes. And then there was a smoking section in an airplane, which is ridiculous. And doctors were smoking in their offices, in between patients. It was just pervasive. And now we would be horrified if we went into a boardroom and somebody lit up a cigarette and there were ashtrays all around the table. So the social norms around that have changed, and they changed not just because of educating people, and not just because of making laws, and not just because of catchy marketing, but because of the combination of all of those things and how people begin to apply pressure to each other. So unfortunately, I think and we don't have a 50-year trajectory like we ended up having with tobacco. But I think thinking about it in that way, that yes, you need the businesses to say we require wearing masks, you need counties and cities and states to say masks are required, but you also need the kind of social media thing about it's the right thing to do. Protect your grandma, protect your kid, protect yourself. You want to be around to take care of your kids, all that stuff.
Yeah. Well, I was looking around at the job market just out of curiosity to see how many public health officer jobs were open in corporations, and there aren't that many. There are starting to be more, sort of chief health officer jobs. And when you talk to private companies or any company, how could they better work with you? How could they better learn from you guys? What do you think their relationship should be with you guys?
So a couple of things. I mean, most people, my experience is that when companies have access to health expertise, it's usually whoever they consult with around occupational health and safety issues, which is different than a public health perspective. But it's also different than a one-on-one doctor.
Those people come from public health backgrounds usually, or are they more?
No, they specialize in occupational health. So they're usually looking at a combination. They may be interested in workplace safety kinds of things, but often a lot of intensive training in workplace injuries and workers' comp things and stuff like that. So this is a little out of their bailiwick as well. So if I can be very frank, local health departments do not have the bandwidth to consult with every HR specialist in every business. And that is really a challenge, because what we would like to do on the public health side is say, here are the parameters, here are the protective measures, the safe practices that everybody needs to be taking, and the conditions you need to create in your workplace. And you know your workplace best. And it's up to you to, figure out how to take these guidelines and operationalize them, if you will, in the workplace. And that's not an unfamiliar model. I mean, that's what OSHA does, right? They don't tell you have to put this table here and that chair there. And where public health has gone is to try to do sort of some sector-specific or industry-specific guidelines, but also industry organizations have created good guidelines. So in Hawaii, I know the the sort of nail salon folks and hair salon folks, I don't know if it's national or local, but have created themselves really rigorous and detailed plans that then the health department can look at and not formally approve or not approve, but say, yeah, these look good. But we can't do that for every single business.
Right. You can't be consultants to companies. Yeah.
Well, there are a lot of public health officials. Fortunately, I am not one of them yet, who are being fired or politically pushed out of their jobs. So there might really be a market for people to get, private industry wages to consult on these matters. I could certainly tell some friends.
Well, okay. Well,
one more thing is that often in a situation like this, we would expect that kind of guidance to come very clearly from the Centers for Disease Control and be meaningful and substantive enough that people could use it to guide what they're doing. And that just has not happened.
Still hasn't happened?
No, I mean, the CDC comes out with guidance, but as you know, they come out with something and then they retract it because somebody didn't like what it said.
Yeah.
And then they put it, so by the time it gets out, it becomes, they've gone from giving guidance to giving recommendations to giving considerations. So I think just that labeling tells us that it gets weaker and weaker and more broad. I think that will change. I mean, there's, and if the pandemic response task force had not been disbanded, we would be in a much better situation. So that's down the line, but that has really made this even more challenging than it needed to be.
Let me ask you another higher level question. I was reading, you have a master's in public health. You were the chief public health officer for Berkeley, for the city of Berkeley, correct? You're a pediatrician. You're now handling Kauai. What do you think people in the business world who are, in HR and they may be facilities managers and so forth, what are some of the things they should learn about that you learn about in public health that they may not have even thought about?
So I'm thinking particularly about COVID-19 because it's really broad.
The main issue.
But thinking about this, what I see, and again, I fault in large part the national guidance that was put out early, and that it's been difficult to change. But early on, there was a lot of focus on environmental cleaning, on surfaces and what kind of disinfection and for how long and all of that. And for people who are sort of the environmental services folks in industry, that's very familiar territory. So, I need to use a different cleaning agent, or I need to do that wipe down, 3 times a day instead of 1, or I need to wear gloves for this. Those and gowns, all of that has been very thoroughly embraced, but all of that is really a sideshow to a respiratory virus. This is a respiratory virus. It goes through the air from person to person. Yes, if I spit on the table and nobody has wiped the table and I wipe the table with my hand and then I pick up a sandwich and hold it in my hand and eat it, I can put the virus into my body. But that is not the major means of transmission. The major means of transmission is if you and I were sitting across the table from each other, talking in normal voices and eating our lunch in a small, not particularly well-ventilated room for half an hour. If I'm incubating that virus or coming down with it, I am very likely to give it to you. So in a way, the focus on those familiar areas that are easier to implement is distracting from really consistent distancing, mask wearing, and to the extent possible, working on improving ventilation. And then I don't know details about ventilation systems, and I know that that's what people want to know. Well, our building has this kind of HEPA filter and this many square feet and this many windows, and that's beyond my area of expertise. But people ask things like, well, I want to counsel students in my little tiny, assistant professor office. If I have a personal fan blowing on me from my desk, will that help? Because that feels like ventilation, but of course that isn't changing the air or cleaning the air in any way. So so I can help on that level. But the bigger system stuff, I think there is some CDC information about that. And I know that people who know more about it.
Okay.
Can I give an example, Josh?
Yeah, sure.
The lieutenant governor here in Hawaii, who is a physician, came down with COVID-19. And he's very much a proponent of masks and all of this. And he was on a press conference talking about it. And he said, well, I wear all my mask all the time. He said, but I think I got it from, one of my staff who turned out to have it when I went over to the Big Island. He works on 2 islands. He says, because, we get to the airport and the 4 of us all got into the van and drove to the other side of the island. So we were driving for an hour and the one guy was coughing, but I didn't really think about it. And we all had our masks, but we were drinking our coffee. So, here's a physician elected official who knows the right thing to do and is telling everybody the right thing to do. But in his real life, day to day, how are you going to sit in the car for an hour drive with people that and in the morning and not drink your coffee? And everybody's doing that. And so even though, and the one guy was coughing, oh, well, he kind of always coughs. I mean, I don't know, but yeah. It's a good example of how we fall down because we know what to do, but we don't do it just for some particular activity, and that's when it gets spread.
And these are very subtle little situations that you may not have thought about. Getting in the car, having a cup of coffee. Yeah. So, I'm reading Apollo Zero. I don't know if you've read that book.
I have not.
It's really interesting for neophytes like me. And he does make the point that this is a big social change that could go on for a year or two. And that, he goes back around prior pandemics and all the things that changed behaviorally. What's your perspective or the, your state's perspective on the timing of this over the next year or so and the vaccine, and what should people do to prepare for the vaccine?
So I must say that I feel more optimistic in the last 2 or 3 weeks than I had for a long time. Yeah. And not on behalf of the department, but on behalf of myself as an individual. In part, that's because of the recent election. And I'm very heartened by hearing the initial plans that the new administration is putting in place to revamp the pandemic response team, because we have had pandemics before and people have been saying, oh my gosh, who could have imagined? And it's like everybody who's been working in public health not only could have imagined, but created plans for this and has practiced for this. And there's lots on the books. And no, it doesn't give us all of the answers, but it's not like this took public health by surprise. But public health also was gutted in 2009 in the recession and was thin to begin with and has never recovered. And something I just thought about the other day that I'm really trying to think about how to make it a message that doesn't sound defensive. But when New York City was overwhelmed with cases and the hospitals were overflowing and the ICU staff and people in the emergency room were getting sick and were getting stressed out and were dying from suicide or COVID, and it was horrible. The outpouring of response was, these people are heroes, and we need to bring in more resources and support our healthcare and hospital infrastructure. In contrast, when local public health departments don't have the capacity to do the contact tracing and case investigation and testing that the public wants, the outcry is, look at our health department, it's a failure. We're going to fire the chief, health officer or health director. You guys need to, essentially create more capacity. Whereas public health resources are limited in exactly the same way that healthcare resources are limited. These are people who are educated and skilled and trained, and you don't just create epidemiologists or skilled data analysts or skilled case investigators, on the fly, any more than you create ICU doctors or respiratory therapists or nurses on the fly. And it's just an interesting, to me, how we've responded to those.
No, I totally get it. I think one of the reasons for that is we non-public health people don't really know what you guys do. Absolutely. Now we're getting it. I mean, one of my goals with this video, honestly, Janet, is to teach people what you guys do and how important it is, and that you should be getting more resources. But I remember when we got together a couple of years ago and you told me you worked in public health, I was like, oh, okay, whatever. I don't know what that is.
Well, it's kind of like you tell me, oh, you're a consultant about
No, but I mean, I think one of my goals to really raise the visibility and the importance of the public health, the profession and the domain, so people take it seriously and you guys can get the resources you need.
Yeah, and to me, it's not about needing to be recognized as heroes,
Yeah.
but it's about needing to be recognized that it is skilled work, and it does have a knowledge base, and it is science-based. It's not seat of the pants, train a few people to do something and send them out the door. It's real work, and it is based in real experience and knowledge and science. And I've been in this the second half of my career. It is the most challenging and intellectually stimulating and meaningful work that I've done. And I feel incredibly privileged to be doing this through this, even though it's also one of the hardest things I've done. I mean, what could be more worthwhile for me to be doing as a doctor and a public health professional right now than this? Anyway,
Well, that's
but
wonderful.
I digressed from something that you asked me that I probably didn't know the answer to.
The future of where you think this
Oh,
is.
right. So I said I was more optimistic and I got off on political. But besides that landscape, the vaccine news is very encouraging in that it is moving along much more quickly than vaccine work ever has in the past, and that what seems to be the effectiveness rate is very, very high. Of course, those data aren't public yet, so there's no way to look at and confirm that. But it makes me optimistic. There's also a multi-state consortium. There may be others, one that California is involved in, that's going to independently look at the safety data and efficacy data of the new vaccines when that's released. And I think given the turmoil and the concern about politicization of the process, and I think the unfortunate warp speed initiative for vaccines. I mean, do you want something injected into you that was developed with warp speed? No, I want it developed with warp responsibility, if you will. So I think that independent review will help. There are going to be a lot of challenges. The cold, to try to get something to lots of people that has to be stored at minus 80 degrees Fahrenheit is an enormous logistical task. But other vaccines that are in the pipeline and coming close don't require that. So the projections that I'm hearing are some doses for emergency responders and frontline healthcare workers as soon as mid-December and rolling out over the next couple months, but probably not widespread availability to the population until the April or so timeframe. And I don't have any insider knowledge about that. I think that's what Dr. Fauci and others have said. So, and even then, somebody was just quoted as saying the day you get your vaccine is not the day you take off your mask. It requires 2 doses. There will still be a lot of disease around. Masks are not 100% perspective in either way. So it's another very strong addition to the layer of things that protect us. And as more and more people are vaccinated, that will be a stronger and stronger layer of protection. So masking may, over the course of the next year or two, become less paramount.
So it's not like a panacea that all of a sudden, boom, the whole thing stops.
No.
We're still going to have to, it's one of the layers.
Yeah, exactly. Kind of like, flu goes around every year and lots of people get vaccinated, but it still spreads, and COVID is still going to do that. Yeah.
One more question for you, and I'll let you go back to work. So there's starting to be discussion with employers about whether they're going to require people to be vaccinated to get on planes and so forth. Do you have any perspectives on that sort of topic?
It's very, very challenging to require vaccinations in any settings. For example, a flu vaccine cannot be or is not generally required even for healthcare workers in very high risk healthcare settings. So I think we're a long way from mandating it. And even where it is mandated, like vaccines are mandated in school, but there are always medical exceptions because there genuinely are some people who can't be vaccinated. So it's a very fraught path to go down. I do think that there are people who will be interested in that, and in the private sector, it's much easier than in the public sector to require that. So it kind of remains to be seen.
People are going to have to carry around a certificate or something that they were vaccinated. How are you going to know if somebody was vaccinated?
For example, if an employer is requiring it, then they can require the information healthcare provider. Yeah.
Well, thank you so much. I really appreciate your time, Janet. And we'll talk again soon.
Pleasure. Okay. Thanks, Josh. Bye.
I really want to thank Janet for all of her time with me this weekend. Janet and I have been friends for 35 years, 40 years, 45 years. And she has been a pediatrician for many years. She ran the public health department for the city of Berkeley, which, as you can imagine, is probably a very challenging job. And she's now in charge of public health for the County of Kauai, which is the island of Kauai. And just one more thing. We are launching our program in the Josh Bersin Academy on workplace public health, and we would love to have you join us. So if you want to learn more about public health and talk about it with other HR people, join us in the academy, bersinacademy.com. We would love to see you there. Thank you.